Montana Matters is sponsored by Montana Psychiatry.
Montana Matters is on the road. We're here at Montana Psychiatry. This is where folks are coming to get help for many mental health issues. Let's go ahead and visit with Dr. Amato. So, Dr. Amato, what is Montana Psychiatry?
So Montana Psychiatry is an outpatient psychiatric practice, and we started in 2009, and we've grown quite a bit over the years to where we now have really a full service experience for the patients who come to visit us. And we serve patients of all ages, I would say probably from the age of 4 up to the age of probably 94. And we treat people with a range of concerns, whether it's depression, anxiety, ADHD, OCD.
So, how long has the road been for people to get here?
Often it's years, and often we're not the first stop that they've made along the way in terms of trying to find answers or trying to find relief for their suffering. But often they've been on many medications, tried a lot of things that haven't worked for them by the time they get to us.
What is the ketamine treatment? I know it's life-changing for a lot of folks. How does it work?
When it works for people, it's really amazing to hear the feedback. Often people will tell me that they've tried so many things, they've been on so many different medications that haven't worked for them, sometimes for decades. And we've had feedback at times that people feel like there's been a total transformation. They see the world differently, their thoughts are more positive, their families and friends are noticing a difference. So it's really wonderful to see.
So what type of solutions do you offer for the patients here?
Well, first we start with a comprehensive psychiatric evaluation because we really want to do a deep dive into understanding what this person's current symptoms are, what things they've tried over the years, and I also want a really good understanding of what underlying medical issues there might be. So after that, if we determine that ketamine is the right treatment for them, what we typically do is an initial series of 6 treatments that are spaced over 2 to 3 weeks. And at our clinic, we administer those usually through an IV infusion that takes about 40 minutes. And after 20 minutes of recovery time after the infusion, they're ready to go home with a driver. And I always encourage people to just kind of take the day to rest and process and integrate the experience that they've had.
TMS therapy, that's another treatment that works when medication isn't necessarily working. Tell us more about it.
Yeah, so TMS is a treatment that's been FDA cleared since 2008, primarily for treatment of depression that hasn't responded to medication therapies. And it's really unique in that it works in terms of stimulating an area of the brain that's been identified as being slowed or sluggish when depression is an issue. And it's a treatment series that goes over the course of 9 weeks, which I know sounds like a long period of time. But it's always amazing how quickly that time passes. And so for the first 6 weeks, people are coming in 5 days a week for a 30-minute treatment. And often they're seeing the world differently, their thoughts are more positive. One common theme I hear is that people feel like they tolerate stress better. The things that used to bother them or that would normally be very upsetting, they're just able to let go of those things easier.
This has been Montana Matters on the road. If you'd like more information, visit their website or give them a call.